Did you know that during pregnancy, you can develop a condition known as pregnancy gingivitis? Hi everyone, I'm Dr. Joyce the dentist. Your mouth and body are closely related, and for my patients who are expecting or trying to conceive, I always tell them how important it is to keep their mouth healthy during pregnancy as well as while they're trying to conceive. Why is that? Because we know through extensive research that having active gum disease during pregnancy can increase your chances of preeclampsia, preterm labor, and giving birth to a baby with a low birth weight. Not to mention, possibly make it harder to get pregnant to begin with. It's almost like being pregnant and smoking. But what about my patients who do take care of their teeth and gums, but suddenly experience symptoms of swollen gingiva and bleeding gums once they're pregnant? We call this anomaly pregnancy gingivitis, or the joys of pregnancy. Similar gum swelling can also affect you during menses or your period, when your hormones are fluctuating all over the place. Now, not everyone will experience pregnancy gingivitis when they're expecting, but it's more common than you might think it is. Even with regular gingivitis, up to 60 to 75% of women can experience symptoms when they're pregnant. The only difference is that pregnancy gingivitis is induced from hormonal changes, rather than not taking good care of your mouth with brushing and flossing. How can you tell which one you have? Number one, you might have pregnancy gingivitis if your gums suddenly get red, puffy, tender, and maybe bleed, but you're already brushing and flossing your teeth regularly. If you were to look in the mirror, you wouldn't see thick layers of plaque buildup on the teeth next to your gums. If you had regular gingivitis, you probably would. Chances are your dentist or hygienist has always complimented you on how good your oral hygiene is, and now you're wondering what on earth is going on. Second, the redness and swelling tends to be a fairly generalized and not in one specific spot occurrence. If it's only one or two teeth, there's a good chance that something else is causing the issue. Usually it's a piece of food, like a piece of popcorn stuck right under your gums, or maybe there's some tartar buildup. Because it's been a while since you've seen the dentist for a checkup, once you get the food out or your dental provider cleans that area, it typically goes away. Third, and please don't let this scare you, cases of pregnancy gingivitis might also involve what we call pregnancy granulomas or pregnancy tumors. These are tiny little fibrous spots, or what you might call a bulbous growth that swells up really large on certain parts of your gums. They aren't pretty. But the good news is that they aren't anything to be afraid of. If you do have pregnancy granulomas, your dentist may be able to laser them off, or you can wait to see if they just go away on their own after you give birth. If they're not interfering with anything, we usually leave them alone and let them run their course. Prenatal dental care is important for both your oral health as well as the health of the baby, so always plan to see your dentist routinely, especially if you are trying to conceive and in your first trimester. That way, during your second trimester, when you're usually the most comfortable and morning sickness has subsided, you can get any work done that might be causing an emergency. Your dental provider will help you determine whether or not your gingivitis is reversible gum inflammation or something more hormone-induced. If it's due to your oral hygiene, you can easily adjust your brushing and flossing routine after your dental checkup and see improvement within a couple of weeks. I also highly recommend to my patients water picks, so ask your dentist if they would recommend a water pick for you as well. But if it's hormonal and a case of classic pregnancy gingivitis, you don't have to panic or suddenly plan periodontal therapy. Just keep brushing and flossing like you should anyway, and wait. As your hormones begin to stabilize, either during pregnancy or after giving birth, you'll almost always see that the redness and swelling starts to go away. It's extremely safe to see a dentist when you're expecting, but for comfort's sake, you'll want to do any work during your second trimester. Be sure to let your dental provider know if you are or could be pregnant, as they'll want to avoid certain products. For example, teeth whitening is not recommended during pregnancy. If you're expecting, everything you tell your dental provider is confidential, so even if you're just a few weeks into your pregnancy or might possibly be pregnant, be sure to let them know. Since we're on this topic, I also think it's important to point out that chronic untreated gum disease is also known to affect fertility rates in couples, regardless of whether the partner has it. We know that the bacteria from periodontal disease can suppress our immune system, contribute to erectile dysfunction, and is even associated with longer periods of trying to conceive compared to couples who have healthy gums. So if you're in the process of trying to get pregnant, but you or your significant other has chronic gingivitis, be sure to make dental checkups part of your comprehensive health plan. If you found this video helpful, hit the thumbs up, subscribe, and I'll see you in the next one. Bye!